I think the key points for the panel, we realized that healthcare reform really focused on coverage and broadening access for 32 million more Americans into our healthcare system. We probably didn't focus enough on payment and delivery system reform, and I think we all realize that we now need to address the affordable part of that Affordable Care Act. In terms of changing the payment system, we need to focus less on volume of services provided and much more on the value and the outcome of those services that are provided. So rewarding providers for good outcomes, for really getting the best value for the patient. I think another strong message that we heard from the panel is making sure that we have patients engaged in the decision making about their health care, that they know what their options are, and we do need to talk to them about the cost of health care. I think a much less paternalistic view of the patient and really treating them and making them a much more informed consumer and partner in their health care. The most important thing, we are pinning a lot of our hopes on the new Center for Medicare and Medicaid Innovation. Medicare is such a large payer, and if we can reform the Medicare program and how it pays providers and get Medicare to reward good behavior, good outcomes, good value, I think we can make a huge change in our healthcare system. So again, having the Center for Medicare and Medicaid Innovation fully funded, fully active, and really looking at what the private sector is doing and focus on what are the good projects out there, where are we getting good outcomes, and how can we bring those changes that are already occurring in the private sector to the Medicare and Medicaid programs. Well, on a personal level, I find them extremely valuable. You get some concrete information coming out of them. And that's what I admire about the approach that Mayo is taking. We're not just talking about change, we're trying to come up with very concrete ideas as to how we can make that change happen. What are the things that we need to focus on? And then take those policies to, whether it's members of Congress or to the Medicare and Medicaid programs, and see if we can get those adopted and implemented.